Hi, my name is Greg Stets. I'm the Associate Administrator for Nemours Biomedical Research at the Alfred I. DuPont Hospital for Children in Wilmington, Delaware. And today I'd like to talk about clinical research coordination. Clinical research coordinators, which I believe are the Sherpas of a sound and well-run research study. Keys to a successful clinical research study require a multiple things that need to be solved prior to the beginning of the study. But pre-planning is important because it identifies all of the components required. Important things to decide before you start the study are who will be the study coordinators, who will be members of the study research team, other staff that will need to be supportive of the study. Are there any ancillary services that will be required? Any specialized equipment? What will the funding source be? And will there be any recruiting issues that need to be solved? What are the recruiting capabilities of your research team? One of the most important things is picking the right person or with the correct requirements and expertise and skill set to be the coordinator on the study. And here at Nemours, we have a variety of staff that have the capability to conduct studies. Some are more capable and have higher level of degree of skill set than others. But basically, choosing the right one will make the study run as smooth as possible. Here we have clinical nurse coordinators, clinical research coordinators, clinical research assistants, and research assistants. A clinical nurse coordinator performs higher level of clinical tasks, and they're able to do things like injections and drug administrations. They're able to do assessments and actually conduct some of the study visits. They are particularly useful in conducting device, drug, and procedural trials. But their salary costs will be the highest of all. Next is the clinical research coordinator. This is a non-nurse coordinator, and it can be he or she can be certified or non-certified. But these people usually have the experience to conduct device and drug trials at a lesser level. They are able to do most of what a nurse coordinator can do, except that they don't have the licensure that the nurse has. And their salary costs are somewhat less. A clinical research assistant is used best in retrospective or prospective data acquisition studies. So if you need somebody to do data mining, pull data from medical records, pull data from databases from your institution, a clinical research coordinator is better equipped and to do this than possibly the nurse coordinator and or the research coordinator. And their salary costs are somewhat less. Other important pieces on conducting a successful clinical research study are involving the coordinators early in the planning, especially involving them in if you take a look at the protocol, if you are developing the protocol or you're working with the protocol supplied by the sponsor, the coordinator is key in helping you identify the issues that could possibly become obstacles to conducting the study. The next important key is delineating the study responsibilities, confirming what is expected, and that means making clear what the PI responsibilities will be, and the coordinator and members of the research team. And what would the necessary training be? What would the regulatory approvals that would be necessary? And who will do the IRB and other document preparation? In Nemours, we have Office of Sponsored Projects, And they are key in helping to develop the budgets, determining the agreements, helping with applications if there are electronic submissions, and they work hand in hand with the coordinators. In Delaware, the Office of Sponsor Project is Mark Patrick, and you can reach him at 537-009. At our Florida sites, Jean Abate is the manager of Office of Sponsor Projects, and you can reach her at 553-096. Thanks.